Chapter 31 Pulmonary Embolism Again. This resident doctor is a bit tricky. You are listening at novelfull.audio. Meng Yingan quickly looked at the monitor, the patient's heart rate suddenly soared, the body temperature was also slowly rising. This operation was originally performed with the assistance of an extracorporeal oxygenator, and the low-temperature environment was controlled to reduce the patient's metabolism as much as possible. Logically, in this case, the patient's heart rate, breathing and other vital signs would be lower than normal. The rise at this time must be an unexpected major accident. If it is not immediately checked, the patient will have to give up limb preservation and terminate the operation. The heart rate has risen to 170. The instrument nurse was pale and reminded. Meng Yingan had a gloomy face. He quickly stopped the operation and began to check the entire surgical area, and Xu Qiu stared at the monitor. Within a few dozen seconds, the patient's ventilation resistance continued to increase, and the blood oxygen saturation had dropped to about 75%. This is an indicator of hypoxia in the body. Normal people are between 95% and 99%, however, Meng Yingan still did not find the problem. There were no bleeding points. In the surgical area, he wiped it with gauze, and there was only a faint trace of blood on it. No, it doesn't look like bleeding. Meng Yingan's face was as heavy as iron, and his tone became more solemn. Xu Qiu looked at the gauze that Meng Yingan threw into the tray, but his eyes lit up. Blood? Xu Qiu suddenly said, Mr. Meng, did you use too much adrenaline? What's the point of adrenaline at this time? Meng Yingan's words hadn't been cursed out yet, but his expression suddenly froze. He stared at the patient's wound with very little bleeding. During the operation, in order to achieve a bloodless surgical area, doctors will inject adrenaline to penetrate the mucous membrane and other parts to stop bleeding. Could it be a problem with adrenaline? At this moment, the patient's blood oxygen saturation suddenly dropped again. Meng Yingan was still a little dazed, but Xu Qiu shouted at this time, "Anesthesiologist, check the tracheal intubation." That the anesthesiologist sitting in the back, who was fully focused on the operating table, suddenly woke up. He hurried over to check, and found that the patient's trachea was already filled with pink endotracheal tubes. Suffocation. Pulmonary congestion caused pink foam secretions, which eventually led to airway obstruction. The anesthesiologist quickly sucked out the secretions, but the patient's blood oxygen saturation only slightly recovered, and he was still in a state of extreme hypoxia. Everyone in the operating room became nervous. If it is not corrected as soon as possible, it will not be a matter of losing a hand, the patient will not be able to leave alive. Pulmonary embolism. Meng Yingan is experienced after all. At this point, he has seen the crux of the problem. In short, the patient has a blood clot in his right upper limb. During the operation, due to excessive adrenaline, the patient's heart rate was too fast and the blood flow was turbulent. The blood clot on the right upper limb was washed down. Finally, it was brought to the narrow pulmonary blood vessels and blocked here. Pulmonary embolism is a critical illness with a very high mortality rate. Quick, please consult the cardiology department. Meng Yingan supported himself on the stage with both hands, and his physical strength was exhausted. His hands began to tremble uncontrollably. It's too late, by the time the cardiology department comes, the person will be dead. At this time, Xu Qiu's voice suddenly broke the silence. He grabbed the ultrasound machine next to him and signaled the instrument nurse to apply coupling agent. Meng Yingan was stunned. He said, "Can you do it? Are you kidding your career?" That he was thinking about loving talents and couldn't bear Xu Qiu to make mistakes. A resident doctor. At this juncture, without waiting for the cardiology department to consult, it would be a violation of regulations to perform a pulmonary embolism operation without authorization. Once the patient died on the stage, Xu Qiu might have to say goodbye to the medical profession. At this moment, Wang Ping stood up and said, "Mr. Meng, I am Wang Ping, I guarantee that he can do pulmonary embolism." Wang Ping. Meng Yingan was delighted. Of course he had heard of this name. He was a mainstay of emergency medicine, and was particularly good at treating various acute and severe respiratory diseases, including pulmonary embolism. Guarantee what the hell? You don't go, and let the younger generation take the blame. Save people quickly. Meng Yingan cursed angrily. Wang Ping moved over, and felt his steps were extremely heavy. His expression was particularly strange. "Mr. Meng, you overestimate me. In the past 30 years, I have saved the lives of 6 patients with pulmonary embolism. The treatment rate is 0%, the only one was saved by Xu Qiu a week ago. Apply the coupling agent." Wang Ping had no choice but to bite the bullet. He winked at Xu Qiu. "I will assist you and listen to your orders, you understand?" Xu Qiu nodded and immediately ordered. "Turn off N20 and ventilate with 100% pure oxygen. Adjust to semi-recumbent position and place a urinary catheter. Give furosemide 20 mg, dexamethasone 8 mg, hydrocortisone 100 mg. Instructions were given one after another, but everyone stood still and no one dared to move. Meng Yingan's face trembled a few times. He raised his head and saw Xu Qiu's calm eyes. At this moment, an idea suddenly popped up in his mind: the other party, it seems that he can really do it. The next moment, Meng Yingan's face sank and said, "Why are you in a daze? Xu Qiu has the final say." As soon as the voice fell, the stagnant operating room immediately started to move, and instantly ran at the highest speed. On the other side, Xu Qiu also completed the transthoracic echocardiogram. The ultrasound showed, local ventricular wall motion was reduced, and the ejection fraction, EF, was 20%. Cardiogenic pulmonary edema combined with pulmonary embolism. Xu Qiu's voice also sounded. Test TT, PT, and APTT immediately. Give urokinase. Heparin. Digoxin injection 0.5 mg intravenous push. Dopamine 7 Ug per minute body weight. Xu Qiu quickly glanced at the monitor and shouted at the same time, "Systolic blood pressure must be maintained above 90. A large amount of drugs was injected into the patient's body without regard for his life. This is the rescue process. Crazy fluid and blood volume replenishment can bring a glimmer of hope for the patient." Finally, after 3 long minutes, the nurse's surprised voice rang out. "Stable. SBP, systolic blood pressure, is maintained at around 100. The blood oxygen saturation also rose to 98%. Xu Qiu, stop using dopamine and switch to dobutamine. The unit dose is reduced to 5 Ug." After saying this, Xu Qiu breathed a sigh of relief. There were already fine beads of sweat on his forehead. Dr. Xu, wipe the sweat." The nurse stretched out her hand and wiped Xu Qiu shyly. The next moment, the whole operating room burst into cheers. "Good. It's back. Dr. Xu is the direct disciple of some cardiology boss, right?" At this time, the director of the cardiology department finally arrived late. Hearing the enthusiastic cheers, he was a little confused. There was no need to welcome himself like this, right? Just when he wanted to get close to the operating table, he was told that the person was back and he could go back. Director of the cardiology department. Next to the operating table. As the patient's vital signs stabilized and the danger was lifted, everyone was in high spirits. "Mr. Meng, we can continue the operation." Someone said. Meng Yingan didn't say anything. Xu Qiu tilted his head to take a look, and his heart suddenly skipped a beat. Chapter 32: The Surgical Skills That Shocked the Audience. You are listening at novelfull.audio. I saw. Meng Yingan's hand in the breast pocket of her surgical gown was vibrating at a frequency visible to the naked eye. The more he tried to suppress it, the harder he shook. Xu Qiu understood clearly. Due to an unexpected incident, the next operation must be completed within half an hour. The operation was only 80% complete. Next, the most critical double pedicle skin flap transplantation will be carried out. Meng Yingan probably knew that it would be difficult to persist in his current state. At this moment, Meng Yingan's mentality was indeed as Xu Qiu expected. His eyes scanned the nearest circle of people. He stopped at the director of the burn surgery department and said, "Can you do it in half an hour?" The director's expression changed and he hurriedly said, "Mr. Meng, my speed is not that fast, it will take at least an hour." He didn't dare to accept this operation. Difficulty is one thing, how is it possible to finish it in half an hour? In the industry, only a few top experts such as Meng Yingan can achieve such a fast speed. Meng Yingan's expression darkened. He looked at the other director and then scanned the surrounding deputy directors. Before any questions could be asked, everyone showed a troubled expression. They know their own strength.
If you can't do it, let alone half an hour, give it an hour, and the chance of failure of the operation is quite high. Meng Yingan was exhausted both physically and mentally. He slowly took out his hand and was about to touch the knife, sudden, that he thought of Xu Qiu. Meng Yingan raised his head, looked at Xu Qiu formally for the first time, and asked in a solemn tone, "You said before that you could do this operation? Can I leave the operation to you? How long will it take to complete it?" 20 minutes. Fart, are you kidding me? Meng Yingan almost laughed out of anger. Newborn calves are not afraid of tigers. Even if he is allowed to recover, the operation time can only be controlled within half an hour. Meng Yingan shook his head. It seems that I have no choice but to bite the bullet and take it on myself. But at this moment, Meng Yingan was once again shocked by Xu Qiu's reassuring gaze. He glanced at his trembling hands, and finally chose to take a step back and said, "Xu Qiu, come on." Good. No unnecessary nonsense. In just an instant, Yi Shuai and Xu Qiu became the center of the entire operating room. Knife. 9 to 0 stitches. 10 to 0 stitches. The operating room was silent, everyone was staring at the table, the only expression on their faces was disbelief. Meng Yingan was also stunned. Under the operating microscope, Xu Qiu's vascular anastomosis skills were even better than his. The sutures between the cephalic vein, radial artery and donor blood vessel have no tension and no cavity. If it weren't for the subtle difference in the color of the blood vessels, it would be impossible to tell that they are two blood vessels. And the diameter of the cephalic vein is only 3.5 millimeters, and the diameter of the radial vein is only about 1 millimeter. The difficulty of suturing is an area that many doctors dare not touch. However, Xu Qiu uses sutures of different sizes with dexterity and ease. The needle pliers seem to have become his third hand. It wasn't just Meng Yingan who noticed this, everyone else in the operating room was also staring intently at this moment, occasionally exclaimed, "They can't even tell the difference anymore." In terms of surgical skills, who is more powerful, Meng Yingan or Xu Qiu? 17th minute of surgery, all skin flaps were transplanted to the corresponding sites. Xu Qiu skillfully uses the 3-point suture method, full-thickness blood vessel wall perfectly matched. Next, he placed a drainage strip at the edge of the wound in the anastomosis area. Finally, a cotton pad was used to cover the surgical area of the right upper limb to keep it warm. A hole is dug in the middle so that the color and temperature of the skin flap can be observed after surgery. After saying this, Xu Qiu put down the needle pliers. The moment the instrument lands on the tray marks the end of the surgery. 18 minutes. The instrument nurse had a dull expression and reported the operation time in disbelief. The operating room once again erupted into overwhelming cheers. Really 20 minutes? This suture, this transplant, this young man. Dr. Xu was ordered to perform at a critical moment, but he still performed so well. He has such a big heart. This is more than just a big heart. My medical skills are so strong, my God, I worship you. Everyone looked at Xu Qiu in surprise, envy, admiration, adoration. All kinds of eyes fell on Xu Qiu. Meng Yingan was also suppressing excitement at this moment. His face had long lost its previous seriousness, and his face was kind, and his eyes were full of gratitude. If it weren't for Xu Qiu, this surgery will most likely fail. It may cause him a lot of trouble and even damage his reputation. But at this moment, Meng Yingan felt even more shocked. He can't understand, how could a resident doctor in his 20s have such a high surgical level? After the operation was completed, Wang Ping quickly took people back to Linhai No. 1 hospital for fear that Xu Qiu would be snatched away. Meng Yingyan, the director of the burn surgery department and others stood at the entrance of the hospital to see him off. Looking at Xu Qiu's leaving figure, everyone looked regretful. If I could accept such a student, I would have no regrets in this life. Meng Yingyan said with emotion. The director was also full of nostalgia. The strength of their hospital is burn surgery, but no one has Xu Qiu's talent. How great it would be if such a genius was in their hospital. Suddenly, a deputy director whispered, "Mr. Meng, director, this Dr. Xu. If I remember correctly, it seems that he has submitted a resume to us." What? The director stared like a cow's eyes and said, Why did he go to Linhai First Hospital? That the deputy director said, we eliminated him. Such a talent was driven away by your human resources department. The director's heart was bleeding. He wondered, how could such a genius be eliminated? So, he asked the deputy director to transfer the resume. Meng Yingyan also became interested. After reading the resume, both of them were silent. Ordinary first class, undergraduate graduation. A genius would actually have such a resume? The director carefully confirmed Xu Qiu's university again. The more he looked, the more familiar he felt. He slapped his head and said, are there any alumni of Xu Qiu in our hospital? That the deputy director quickly checked and said with a strange expression, there is indeed a person named Xiaolu. Him. The clumsy guy who can't even change the dressing properly. That the director immediately showed a disappointed expression. I thought too much. Xiaolu is the level of resident doctors in ordinary colleges. On the other side, when Xu Qiu returned to the hospital, it was already evening. After changing his clothes, Wang Ping called and said happily, Xu Qiu, I really can't see through you anymore. I'll treat you to dinner tonight. Give the director face. Xu Qiu smiled and agreed. When everyone in the office heard that Xu Qiu was going to have dinner with Director Wang, everyone showed incredible expressions. Chapter 33 Lowering the score line just to admit Xu Qiu. You are listening at novelfull.audio. Xu Qiu was a little confused as to what was going on. Wang Fan explained, Director Wang is a strict wife. His wife was worried that he would be seduced by enchanting little nurses, beautiful medical representatives, and young female students, so he never attended dinner parties. Xu Qiu understood. Rumor has it that medical students have 4 wives. The first one was a classmate in college, the second term was a nurse in the hospital, the third one is a beautiful and sensible medical representative, the last one was a female student whom I taught. Of course, this is just a joke. In fact, doctors generally do not marry medical representatives, only 3. By the way, I heard that you went to visit Mr. Meng's surgery today. How about it? Are you scared? Zhou Hua, a senior attending in the emergency department, joked. Xu Qiu nodded, was frightened. After chatting for a while, Xu Qiu packed up her things and left work, preparing to go out with Wang Ping for a meal. Shortly after Xu Qiu left, Zhou Hua's phone rang. When he saw it, he saw that it was his old classmate from the International Friendship Hospital. The other party is doing better than me and is already the deputy director. What brought you here to call me? Zhou Hua picked up and said, the other party didn't say anything and asked eagerly, what's going on with Xu Qiu in your department? Xu Qiu. He just got off work. What's the matter? Damn it. Have you experienced World War II? Why are you so calm? Zhou Hua suddenly realized that there was something in the other person's words. He quickly asked, what's going on? You don't know yet? Meng Yingyan, you know, right? Something went wrong during Mr. Meng's surgery, and no one can take over. Then Xu Qiu from your department came up and completed the operation directly, and he did it even better than Mr. Meng. Fuck. Zhou Hua put down the phone and was stunned. He remembered what he said to Xu Qiu. He also asked the other party, have you ever been frightened? At this moment, Zhou Hua felt ashamed. To be frightened is to be frightened, but it was Xu Qiu who frightened the others. In the office, other people saw Zhou Hua's expression as if he had seen a ghost and hurriedly asked what was going on. Zhou Hua recounted the incident. The office, which was originally filled with the cheerful atmosphere of getting off work, suddenly fell silent. Damn, this is unreasonable. Is Xu Qiu cheating? Lin Xie, Meng Yingyan, Xu Qiu, are you going to kick the experts across the country and beat the originators of all kinds? It's Xu Qiu, isn't that weird? What's the end of the shift? I'm not getting off work. Hurry up and register, otherwise we won't even be as good as a resident doctor. Woo woo. I'm going to the operating room to practice operations. I have to catch up on the article. Under the dazzling light of Xu Qiu, everyone suddenly realized how much of a noob they were. As a result, everyone in the emergency department began to crazily write about medical skills, articles, and surgical procedures, and this directly led to the emergence of several more SCI articles in the emergency department in the next month, around 7 o'clock in the evening. Xu Qiu sat on the sofa in Wang Ping's home. Wang Ping, who is in charge of the entire Department during the day. At the moment, I am wearing an apron, chatting and laughing, washing vegetables and cooking with my wife. Xu Qiu wanted to help, Wang Ping said, don't disturb the world between me and my wife. At 7:30, the food is served. Xu Qiu waited for the couple to start picking up the food, and then started eating without being humble or overbearing. Wang Ping was a little surprised. This young doctor not only has excellent medical skills, but also has an impeccable manner in life, which makes people feel very comfortable. Halfway through the meal, Wang Ping stopped chatting and mentioned the real purpose of this time, saying, Xu Qiu, I remember that your current academic degree should be a bachelor's degree, right? Xu Qiu nodded, yes. I didn't think about improving my academic qualifications before, I just indulged in practicing surgery. No wonder your current clinical level is so solid. After Wang Ping finished speaking, he was silenced by his own words, more than just solid. Which of the skills Xu Qiu possesses does not require decades of intensive study to accumulate? Wang Ping was a little greedy. Such a young doctor is in demand wherever he goes. He got straight to the point. I wonder if you have any plans to continue to improve your academic qualifications. Xu Qiu thought about it. If he continues to be stuck in the undergraduate program, his promotion will be greatly hindered. For example, after graduating from a bachelor's degree, you need to be a resident doctor for at least 4 years before you can be promoted to an attending physician, and you need to be an attending physician for at least 5 years before you are eligible to be promoted to an associate professor. However, if you switch to a master's degree, it only takes 2 years to be promoted to the next professional title. Although Xu Qiu is likely to take the promotion path of special talents, however, if you improve your academic qualifications first, you can avoid a lot of criticism. Thinking of this, Xu Qiu nodded, I plan to get a master's degree. Wang Ping's eyes immediately lit up. He put down his job and solemnly said, Xu Qiu, let me introduce myself solemnly. I graduated from Chengdu Union University and am currently the director of the emergency department of Linhai No. 1 Hospital, a professor at Linhai University School of Medicine, a doctoral supervisor, a member of the lung cancer group of the Daxia Medical Association, and the vice chairman of the pulmonary embolism group. Daxia. As the 4th completer, I won the first prize of National Science and Technology Progress Award. I have published more than 80 research papers as the first and corresponding author. At the dinner table, listening to Wang Ping's eloquent self-introduction, his wife was stunned. What's going on? On weekdays, all kinds of directors and deans come to Wang Ping's door just to get on good terms with him and want him to accept a few students, and in the province, if you want to do emergency medicine, Wang Ping is definitely the first choice. Students always beg Wang Ping to accept them. But today, he is actually introducing himself and begging students to choose him as a teacher. His wife was shocked, but she was very considerate and restrained her shock. She quickly took out the treasured good tea from the study and brewed it, poured a cup for Xu Qiu and Wang Ping respectively. After pouring the tea, the two of them had almost finished chatting. Xu Qiu did not refuse in the end, since he planned to work in Linhai First Hospital. Choosing Wang Ping as a mentor is indeed the best choice, but, Xu Qiu said, Director Wang, I am now a social candidate. It will be a bit troublesome if I take the recommendation route. Wang Ping nodded, it's a bit of a headache indeed. If you are a fresh graduate, you can get a recommendation without taking the test, but it's much more complicated for graduates of previous years. Although there is a channel for special talents, it requires various awards. Xu Qiu is definitely a special talent, however. The medical department only recognizes awards above the provincial level, so this path is not feasible. Wang Ping took a sip of tea and said, don't worry about this, I'll help you find a way. Xu Qiu thought for a while and said, Director Wang, there's no need to be so troublesome, I'll take the exam again. Wang Ping was stunned for a moment. Yes, this is the most formal and convenient way. Are you sure? Wang Ping asked. The postgraduate examination is not easy for working doctors. After doctors enter the clinic, they will definitely become more and more proficient and skilled in a certain department. On the contrary, the knowledge of other departments will slowly fade away. However, postgraduate examinations are all about medicine. Clinical doctors may not score as high as those candidates when they take the exam, he said. We at Linhai University can set our own scores. If you are not sure,
I will communicate with the university and directly lower the re-examination score by 180 points. Xu Qiu was a little surprised, lowering the score line just to admit himself. Looking at Wang Ping's serious expression, this is for real. Chapter 34 Pretty Little Intern Takes Up the Job. You are listening at novelfull.audio. But, Xu Qiu took the initiative to take the postgraduate examination again for another purpose, that he wanted to give it a try and break the exam record. In the more than 30 years since the postgraduate examination was launched, the main subject of the medical postgraduate entrance examination, Integrated Western Medicine, ranks first in the difficulty level of postgraduate examinations in all disciplines. No one has ever gotten perfect scores on multiple choice questions, not to mention the perfect score for the entire role. Even if it was Xu Qiu in the previous life, when he took the exam, he also lost more than 20 points, with a total score of 278, and these are already considered the top few, but this score is too low for Xu Qiu today. A perfect score is his current goal. Xu Qiu took a sip of tea and said, "Director Wang, there is no need to lower the admission threshold. It's not a big problem." Wang Ping smiled and said, "That's right. It shouldn't be difficult for you to get 220/230. I'm just worrying too much." Wang Ping's wife also raised her cup at this time, looked at Xu Qiu with a smile, and said in a gentle voice, "Xiao Qiu, I wish you good luck in the exam in advance." The three of them raised their glasses at the same time. After the meal, Wang Ping drove the car himself, with his wife sitting in the back seat, and the couple took Xu Qiu home together. Both of them were very kind, chatting with Xu Qiu about everyday matters, and already regarded him as a close student. The next day, at 8 o'clock, after routine rounds in the emergency department, doctors at all levels return to their posts. The director and deputy director are busy with outpatient clinics and surgeries. The attending surgeon also traveled to various operating rooms and followed the directors in their work. Resident doctors are responsible for patient management, including but not limited to sending reports to patients, handling feces and urine, writing cases, etc. And interns, they squatted in demonstration classrooms, lounges and other places. They eagerly wait for the superior doctor or nurse to grant them a chance to suture or observe surgery. On this day, a beautiful little intern came to the department. She was holding a book, with a tender face, black hair, and sparkling eyes. Qiao, a female college student who had her appendix removed by Xu Qiu before. She has basically recovered now, so she resumed her medical internship and happened to rotate to the emergency department. Many boys' eyes secretly drifted to Qiao, but Qiao was reading a book on the surface, but in his heart there was a figure in a white coat. When she thought of Xu Qiu, she became elated. At 8:30, Lu Susu came in pushing a cart. She plans to randomly select a lucky intern and send it to help Xu Qiu take care of outpatients. Suddenly, she noticed Qiao, who was the most handsome. "You were Dr. Su's previous patient." Qiao stood up quickly and said politely, "Sister Susu, it's me. I'm also a medical student. I'm doing my internship in my 5th year this year." Lu Susu felt relieved and joked, "Why didn't you tell me earlier? If I had known, I would have asked you to change the dressing yourself." Everyone burst out laughing. It is reasonable for medical students to go to the hospital and prescribe and change their own medicines. On the other side, Lu Susu saw Qiao's sweet mouth and had a candidate in mind. The arrangement was, "Then it's up to you. Go to clinic number 7 and follow Dr. Su's clinic." Surprise appeared on Qiao's face. Dreams come true. She immediately smiled sweetly and said, "Okay. Thank you, Sister Susu." Almost running all the way, at 8:40, Qiao arrived at clinic number 7. There were already patients inside at this time. Qiao gently pushed open a crack, trying to get in, but the breasts are a bit big. She opened the door halfway, slipped in, and looked inside. Under the sunlight coming from outside the window, Xu Qiu was carefully auscultating a female patient. Her hair is like black jade, and her facial features are carved, neat and clean. Qiao's heart almost jumped out of his chest. She walked a few steps quickly and stood next to Xu Qiu obediently. After waiting for Xu Qiu to finish handling the patient, Qiao said carefully, "Teacher Xu, I am an intern here to follow your clinic." "It is you." Xu Qiu looked back. At that time, he knew that Qiao was from Linhai University.
but he didn't expect that he would become his intern. "How's your recovery going?" Xu Qiu originally just asked casually. Unexpectedly, Chen Xiao pulled open his white coat, revealing his flat and smooth belly, and said happily, "Look, it's completely healed. Teacher Su, there really aren't any traces left." Xu Qiu nodded, indeed recovering beautifully. Returning to the topic, he asked, "Do you know what to do with the clinic?" "Yeah, I need to lay out disposable sheets for the patient, teach the patient how to position themselves, and help you prepare everything you need before the examination. Go call the next patient." Xu Qiu said, with an assistant, "He doesn't need to worry about many trivial things, the efficiency will also be much higher." In Chen Xiao's clear voice, the next patient entered the consulting room. The person who came in was a tattooed young man, 27 years old. As he walked in, he coughed violently several times. "What's wrong?" The young man coughed and stated. "Doctor, I've been coughing for several days, and I've drank several bottles of emergency syrup, but it doesn't work." Xu Qiu observed the other party. His face was pale and his lips were cyanotic. This is a sign of hypoxia. Many diseases of the respiratory and circulatory systems can cause hypoxia, which has no diagnostic significance. The young man looked very bad, and continued, "Also, my chest hurts. I took my temperature when I came here, and it was 38.2 degrees. Xu Qiu said, "Pull up your clothes, let me listen." There are wet rows on auscultation, like blisters, snoring. In addition, there are bronchial alveolar breath sounds, the most common manifestation of pneumonia. After listening, Xu Qiu asked a few targeted questions. "Have you had a cold in the past month?" "No." "How long have you been coughing?" "It started to get serious in the past 2 days, and the medicine didn't work." Xu Qiu keenly grasped the subtext of the words. He asked, "Started to get serious? Did it happen before?" The young man said painfully, "Yes, I used to cough a few times for no reason, for several years." "Several years?" Xu Qiu ruled out ordinary bacterial pneumonia in his mind. This disease usually has an acute onset and the course of the disease is at most 3 or 4 weeks. If a cough can last for several years, it is obviously not ordinary pneumonia. On the contrary, it is more like tuberculosis. Xu Qiu asked a few more symptoms, all of which were consistent with the manifestations of tuberculosis: night sweats, fatigue, repeated fever, long-term cough. "I'll prescribe a chest CT and a sputum smear culture for you." "Okay." After the patient left, Chen Xiao said without any danger, "Teacher Su, I was almost fooled by him. It turns out that he had the symptom of coughing for a long time." Xu Qiu, patients will subconsciously ignore many symptoms. As a doctor, you have to analyze the meaning of their words. "Okay, I remember it. Next patient." Chen Xiao hurried to call the number. After seeing 5 more patients, the young man came over with the results of the chest CT. Xu Qiu glanced at it and the imaging diagnosis results did suspect tuberculosis. However, his brows frowned. Chapter 35 Tricky Cases, Unbelievable Causes. You are listening at novelfull.audio. There are indeed patches, nodules and cord shadows on the young man's chest CT film. This is considered a manifestation of tuberculosis, but not typical enough. More definite tuberculomas, or old tuberculosis lesions, calcifications, etc., cannot be seen. Waiting for sputum smear culture. Chest CT can only be used as a preliminary screening. The gold standard for tuberculosis is the discovery of Mycobacterium tuberculosis in sputum. Soon after, the results of the patient's sputum culture came out. No acid-fast bacilli were found. At this time, Dr. Gu from the laboratory department called and said gently, "Dr. Su, although this patient is negative for Mycobacterium tuberculosis, it cannot be ruled out. Clinically, Mycobacterium tuberculosis can only be found among tuberculosis patients. 20%. Xu Qiu did not refute. Indeed, the Mycobacterium tuberculosis bacilli are hidden deep in most people and will not be excreted into the sputum from the bronchi, so sputum culture may not find anything. At this point in the diagnosis, the average doctor may have chosen diagnostic anti-tuberculosis treatment. Right now, although there is not enough evidence to confirm tuberculosis, but to be on the safe side, Give anti-tuberculosis drug treatment first. If valid, the diagnosis is established. Otherwise, consider other diseases. Xu Qiu did not do this. The course of anti-tuberculosis treatment is often measured in months or half a year. If it is wrong, it will delay the disease too much. The condition is still unclear now. I suggest another bronchoscopy. Xu Qiu said. The young man frowned. He was a little dissatisfied with the repeated inspections, but when he saw a beautiful female doctor next to Xu Qiu, he stiffened his neck and nodded. It's a small problem. You can cure my disease for any amount of money. After the patient left, Xu Qiu looked back at Chen Xiao. Unexpectedly, interns have such a use. Chen Xiao still didn't understand why, so he tilted his head and said, "Teacher, what's wrong?" "It's okay, let's go to the next patient." Bronchoscopy is a scary examination item. The mirror passes through the patient's nasal cavity, enters the throat, turns into the airway, and finally penetrates into the lungs to directly obtain the diseased tissue, secretions, etc. in the lungs. Through this check, doctors can also directly find the Mycobacterium tuberculosis bacilli hidden deep inside. If this test is still negative, tuberculosis can basically be ruled out. Unfortunately, this time still no Mycobacterium tuberculosis was found. The patient is anxious. I coughed a few more times, and this time in addition to phlegm, there was also blood. His face turned pale and he said, "Doctor, can you do it? If it doesn't work, I'll fly to Chengdu to find an expert to check." Xu Qiu remained calm, but felt strange in her heart. Did the disease develop so quickly? It's not pneumonia, it's not tuberculosis, what else could it be? The patient does not have symptoms such as heart failure. Where's the previous chest x-ray? Chen Xiao quickly found it. Xu Qiu took it and compared it carefully against the light. Suddenly, his pupils shrank. There are many infection lesions in the patient's lungs. It can even be described as a complete mess. However, there is a very strange phenomenon in the lower lobe of the right lung. The infections there are surprisingly neat. It's like throwing a bunch of beans on the ground. Logically speaking, it should be said to be chaotic and disorderly. However, at this moment, some of the chaotic beans formed a long line, very inconspicuous, but it exists. Straight line infection. An idea popped into Xu Qiu's mind. He glanced at the tattoo on the other person's arm and asked, "Have you been injured?" The young man was stunned for a moment, with a surprised look on his face, and said, "Can you see that?" That he said, "One time I went out to have a barbecue. After drinking too much, I got into a fight with the table next door. Those bastards couldn't beat me at all." Barbecue. Bamboo stick. Xu Qiu already had the answer in her mind, and said, "Get a chest-enhanced CT and then do a three-dimensional reconstruction." "It's a bit expensive, is that okay?" The young man said scornfully, "Just check it out, there's no shortage of money." After the patient left, Chen Xiao said with emotion, "The teacher is so awesome. He checks whatever he asks, and the patient doesn't have any opinions at all." Xu Qiu glanced at Chen Xiao. It seems that this girl doesn't know how lethal she is to men. Before leaving get off work, the patient came back with the examination for the third time. In the three-dimensional reconstruction, you can see that the patient's lungs have a long and thin shadow running across them. The young man was frightened and said, "Doctor, what is this thing?" Xu Qiu did not answer, but asked calmly, "Did your coughing start after that fight?" "It seems so, I don't have any impression. This thing, if I guess correctly, should be a bamboo skewer for barbecue." The young man's face suddenly turned pale, and he was startled and said, It seems that someone really stabbed him everywhere with bamboo sticks at that time." Xu Qiu nodded. "Now it's right, bamboo sticks are made of wood and are difficult to visualize on CT and enhanced CT, so they cannot be found at all. If the bacteria had not adhered to the swab and created a linear infection line, I'm afraid the patient's true cause would have been found only in the autopsy." The patient was frightened and said, "Doctor, how could it be a bamboo stick? How could I not know if such a long stick was inserted into it?" Xu Qiu explained, "The internal organs are different from the skin. The internal organs have very few sensory fibers and are very insensitive to stimulation such as stinging and cutting. On the contrary, it is very sensitive to traction, expansion, cold and heat, ischemia, etc. This is why, every time during abdominal surgery, Xu Qiu would remind him, we need to explore, that this is because the warmth and pulling of hands can cause a violent reaction in the gastrointestinal tract, which is likely to cause the patient to vomit unconsciously, resulting in death from suffocation. This requires anesthesiologists to maintain a high level of vigilance, Xu Qiu guessed. You must have been very drunk at the time, so you didn't feel the bamboo stick being inserted into your lungs. During the subsequent fight, the bamboo stick was completely submerged. When he woke up, only a small hole remained. In addition, you can't feel your internal organs, so you don't realize that there is an extra bamboo stick in your body. The young man's expression changed again and again, and he said, what should we do now? Xu Qiu, the only treatment option now is to open the chest and take it out. If it is not removed, the inflammation will remain. After repeated infections, sepsis may develop, causing right heart failure. Once that step is reached, there is no chance of surgery. Doctor, I need to have an operation, please save me. That the young man realized the seriousness and was hospitalized immediately. On the day the patient was admitted, news of the bamboo stick man spread throughout the emergency department. Directors He Hai and Wang Ping were speechless. He Hai Dao, such a tricky case was diagnosed on the same day. Directors of other departments said, there was a patient before who had a similar situation to this. After 3 years of diagnostic anti-tuberculosis treatment, it turned out that he had fish bones lodged in his lungs. It can't be found out either. In the end, the right heart function became insufficient, and there was no chance for surgery. All I could do was wait for death. Wang Ping became happier as he watched. Xu Qiu is awesome, and he, as the future mentor, is also very honorable. But, when the patient is admitted to the hospital and further diagnosed, a question that made everyone worried. Chapter 36. This operation was accepted by our emergency department. You are listening at novelfull.audio. Surgery. How to do it? Who will do it? The patient's bamboo stick penetrated most of the lungs and pierced the left pulmonary artery. Once it is removed, there will be a hole here, and heavy bleeding will occur. Later, the pulmonary artery must be repaired. Open the chest, take out the object, sew up the artery, repair the lung tissue, etc. There is also an infection that spreads all over the lungs and even spreads to the vicinity of the heart. The difficulty and danger of this operation are both top-notch. Wang Ping hurriedly reported it. The medical department gave instructions that night and summoned experts from a total of 8 departments, including thoracic surgery, cardiovascular surgery, and otolaryngology, head and neck surgery, and planned to conduct an emergency consultation for all staff 3 days later. The outpatient clinic ended that day. Chen Xiao wrote half a page in her diary. The last sentence is, Teacher Su is so quiet and aloof. However, he is very accurate in diagnosing diseases and is very responsible. No disease can escape his discerning eyes. Woohoo, I feel that everything can be seen through in front of him. The next day, Xu Qiu followed the deputy director to participate in the morning rounds. He signed in by the way. Ding! You have completed the sign-in at Linhai First Hospital. Impact Factor 5.3. Received a medium-sized bonus. Reward Abundance ** 5.3. Congratulations on obtaining Master-Level Superconducting Visual Bronchoscopy Intervention. Before, Xu Qiu had inherited the experience of master-level intervention. At this moment, after mastering the superconducting visual bronchoscopy technology, his understanding of specific interventional techniques has risen a lot. After receiving the indoctrination of the master-level superconducting visual bronchoscopy intervention, Xu Qiu's eyes lit up. This operation is just suitable for minimally invasive removal of foreign bodies. It seems that the main surgeon of the bamboo stick youth has been settled. Teacher Su, I'm here. At this time, Chen Xiao squeezed out of the crowd holding a surgical book. She stood next to Xu Qiu. Xu Qiu nodded, focusing on the patients in the ward. Chen Xiao secretly glanced at Xu Qiu. She stretched out her snow-white chin and stood on tiptoe. She couldn't help but sigh. So tall, she must be about 1.8 meters tall, right? The ward rounds were coming to an end. Among the last few patients was the bamboo stick youth from yesterday. He heard last night that he would have a hospital-wide consultation. At this moment, seeing so many young female doctors, he suddenly said heroically, "Don't be so grand, I'm fine, and you actually have a hospital-wide consultation for me." cough cough cough. Before he finished speaking, he suddenly started coughing violently, his expression became extremely distorted. Ugh. Suddenly, a large amount of blood spurted out of his mouth, the white bed sheet instantly stained a large area red. At the same time, the patient's face turned pale as paper in an instant, and his eyes were bloodshot due to the pain. The whole ward was filled with his screams. The interns immediately panicked. Chen Qiao also saw this kind of scene for the first time, and subconsciously looked at Xu Qiu, in the panicked crowd. Xu Qiu walked forward calmly and handled it calmly with the deputy director. Diazepam, anti-shock, hemostatic drugs. After a short rescue, the patient's condition finally stabilized. The deputy director panted slightly and looked at Xu Qiu gratefully. At this time, Xu Qiu took off his bloody gloves and said calmly, "You can't wait for 3 days. Convene a full hospital consultation immediately." The deputy director nodded quickly. "Okay." Half an hour later, the emergency department meeting room. The full hospital consultation was held urgently. Experts from 8 departments came, and each surgical team was discussing the plan, but when it comes to success rate and risk, everyone was silent. The success rate is very low and the risk is too great. Now he suddenly had a violent cough, causing the bamboo stick to damage a wider range. "We can't delay it any longer. If the bamboo stick is displaced and not removed quickly, it will be a time bomb." Wang Ping frowned, but he didn't dare to operate. Somehow, Wang Ping's eyes wandered around the experts and fell back on Xu Qiu. "How could I be able to do this kind of surgery? I really..." Wang Ping's self-mockery was not finished yet. In his surprised eyes, Xu Qiu stood up again. At this moment, all attention was focused on Xu Qiu, this young doctor. Bone reconstruction, laparoscopy, flap transplantation, etc. The endless technologies have made him famous. Everyone was waiting for Xu Qiu to speak. At this time, Xu Qiu took out a drawing and said, "No need to open the chest. This patient can undergo superconducting visual bronchoscopy intervention. Minimally invasive intervention." The director of the interventional department shook his head and said, "Too difficult." He explained, "Even with an open chest, it is difficult to stop heavy bleeding. It is impossible to stop bleeding with such a small incision." The others also shook their heads. "It is extremely difficult." Xu Qiu said calmly, "I will do this operation." "What? Dr. Su, don't force it." The interventional department and the cardiology department both said no. The emergency department should not interfere too much in the affairs of the specialist. There are many different opinions, but basically no one trusts Xu Qiu. In fact, everyone has long discussed interventional surgery, and the failure rate is many times higher than that of open chest surgery. It can even be said that if there is a massive hemorrhage, death is certain. And the probability of this patient suffering from severe bleeding is over 95%. Seeing that her words had no effect, Xu Qiu turned her attention to Wang Ping. The other party showed a questioning look. Xu Qiu nodded affirmatively. Snapped. The next moment, Wang Ping patted the table. The conference room fell silent for a moment. Wang Ping said in a tone that left no room for doubt, "We performed this operation in the emergency department. Superconducting video bronchoscopy interventional surgery is a very high-level procedure and cannot be performed by a resident doctor like Xu Qiu. Therefore, this operation can only be guaranteed by Wang Ping. If something goes wrong, Wang Ping will be responsible for everything." After taking Chen Qiao to handle the outpatient clinic in the morning, Xu Qiu took a good nap. In the afternoon, "I was full of energy and prepared for the operation." Wang Ping called and asked, "Xu Qiu, do you really need a combined surgery from the cardiac surgery department, interventional department, and respiratory department?" Generally speaking, this kind of surgery involves extracardiac intervention to block blood vessels, then have the foreign body removed by a gastroenterology/respiratory doctor. Everyone performs their duties, each is responsible for the steps of their own specialization. But, Xu Qiu refused. With master-level intervention experience, coupled with master-level superconducting video bronchoscopy intervention, the rest of the people who came to help were holding him back. For every additional person, his surgery success rate will drop by a notch. At this time, in the director's office. "Okay, I believe you. I also have an operation in the afternoon. You can call a few deputy directors yourself. I'm waiting for your good news." After saying this, Wang Ping hung up the phone. He glanced at the surgery schedule. I have an intestinal obstruction surgery in the afternoon, which is expected to take an hour. Xu Qiu's station, it will take at least 2 or 3 hours. After you finish it, you can go to Xu Qiu's operating room to be an assistant or something to help him relieve some pressure. After Wang Ping came on stage, Xu Qiu's surgery was about to begin on the other side. At this time, several people suddenly broke into the office and asked, "Who is Xu Qiu?" Chapter 37 Simple Ideas, Ultimate Skills. You are listening at novelfull.audio. Inside the office, Xu Qiu was about to leave for the operating room when he heard the sound and looked towards the door. I saw 3 men with tattoos on their arms standing at the door. He is fierce and looks very tough to deal with. The 3 of them looked at Xu Qiu with unfriendly eyes. Are you Xu Qiu? You are too young. How can I leave my brother to you? You saw that my brother had a Pikachu tattoo, and you thought he was easy to bully, so you used him for training, right? Substitute, replace. 3 people blocked the door of the office. Xu Qiu was helpless. He glanced at the surgery schedule. Wang Ping, Hai, and others all went for surgery. The only ones who can turn to for help now are the bald directors. Xu Qiu thought for a moment and dialed the number of Director Huang of the Interventional Cardiac Surgery Department, which had the least number of calls. The director rushed over quickly, when the 3 of them saw Director Huang's king-like hairstyle. They immediately felt relieved and let Xu Qiu go. On the way to the operating room, Director Huang said calmly, "Xu Qiu, Wang Ping guarantees you that if something goes wrong with your surgery, Wang Ping will basically say goodbye to the medical industry." Xu Qiu nodded. Master-level superconducting intervention. It is still a bit difficult to fail. Seeing Xu Qiu's calm expression, Director Huang became even more confused. He originally thought that he would save the day and then go back, but now I changed my mind. He wanted to see it. Where does this young doctor get his confidence from? Xu Qiu, I'm going to have surgery soon. Something's really going to go wrong. I'm here to help you figure it out. Director Huang said confidently. After all, he is also the director of extracardiac intervention. With nearly 40 years of experience, he can't even compare to a resident doctor, right? Half an hour later. The patient was paralyzed. The monitoring of various vital signs such as SAW2 is normal. Heparin 10,000 IU. Inject through the arterial sheath. Intracoronary injection of 200 μg of nitroglycerin. Xu Qiu carefully flushed the guide wire cavity of the instrument and at the same time asked for medication during the operation. Soon, the patient's systemic heparinization was completed. At this time, Director Huang was completely confused. Scrub the guide wire lumen. Isn't this an operation to place a vascular stent? He immediately guessed Xu Qiu's intention and asked tentatively, "You plan to block the pulmonary artery first and then perform surgery?" Xu Qiu nodded calmly. Director Huang was completely dumbfounded. This surgery is very time-sensitive, the shorter the better. Any time longer than 3 hours may exponentially increase the chance of infection. Superconducting interventional surgery inherently takes a long time. Now, Xu Qiu has added an additional surgery of stent placement and closure. Can this be done? What answered him was the stent connector that was inserted into the patient's blood vessel in the blink of an eye. Director Huang's heart immediately rose to his throat and he looked around hurriedly. At this time, Xu Qiu had smoothly pushed the stent into the blood vessel. He stared at the monitor screen. The wrist is constantly shifting and twisting subtly. Then, Director Huang was surprised to find, on the screen, there were many tortuous and winding blood vessels, but they did not block the route of the guide wire at all. Under Xu Qiu's control, the guide wire quickly passed through the bifurcation with incredible deflection every time, and finally reached the pulmonary artery. Confirm the location again. Next, Xu Qiu implanted the stent into the pulmonary artery. At the same time, clean up the surrounding eroded blood vessel gaps, infections, etc. Director Huang stood there with a shocked expression, feeling that the scene in front of him was too magical. How could the guide wire in his hand be so obedient? And, how long did it take? 2 minutes. Is this an operation that can be completed in 2 minutes? Get ready, superconductor is stepping in to remove the foreign object. At this time, Xu Qiu's voice sounded again. Only then did Director Huang come to his senses and quickly acted as an assistant. At this moment, he already regretted his previous thoughts. Help Xu Qiu cover up. Xu Qiu is enough to give him the scoop. If Xu Qiu can't even finish it, all he could do was stand by and say to the patient, 321, time of death is XXX. 20 minutes passed quickly. In the operating room, Xu Qiu steadily pushed the superconducting video bronchoscope into the patient's nasal cavity, slowly reach the preglottis, deep under the glottis, instill the anesthetic and suck up the secretions. After passing through the glottis, the anesthetic is dripped in sections. Finally, on the screen, a pointed object appeared. There are colonies of different sizes on the object. I found the bamboo stick. Everyone in the operating room cheered, but Director Huang's expression became even more solemn. It's not hard to find bamboo sticks, the difficulty is how to remove the 8 cm long bamboo stick from the patient's body without causing too much harm. Get ready, alligator tooth pliers. Xu Qiu's voice sounded. He controlled the alligator tooth pliers and slowly reached the location of the bamboo stick. Under Director Huang's shocked gaze, Xu Qiu cut off the bamboo stick section by section, and then took it out in pieces. Every cut is accompanied by the risk of the bamboo stick shifting and nicking the blood vessel. Massive bleeding is one thing, moreover, the bamboo sticks are also covered with infectious bacteria. Once it enters the blood, the consequences will be disastrous. But, every time, Xu Qiu always managed to cut off the bamboo stick safely. Director Huang's palms were sweating. He knew that if he did it himself, the bamboo stick might shift the first time he cut it. 15 minutes later, when Director Huang saw the last bamboo stick fall into the tray, he finally breathed a sigh of relief. Finished, done. Director Huang was sweating all over. He wanted to move his feet, only to find that his legs were a little weak. Moving to the side of the tray, he simply put together 7 or 8 bamboo sticks and measured with a ruler, 0.7.8 cm. A foreign body of nearly 8 centimeters, and it penetrated into the pulmonary artery. It was actually removed by intervention. Director Huang was extremely shocked and couldn't believe his eyes. According to common sense, such a large foreign body can only be removed by thoracotomy. Minimally invasive interventional surgery can only deal with small foreign bodies, such as fish bones, keys, etc. A few years ago, Director Huang encountered a patient with a fish bone piercing the alveoli. In that operation, a total of 8 departments were involved to remove the 2 cm fish bone. Result, Xu Qiu single-handedly took out the 7.8 cm bamboo stick by segmented cutting. The method is not difficult, the difficulty is the control of strength and the precise balance. If there is a slight deviation, the bamboo stick will lose its support and may become a fatal knife, piercing the surrounding organs or even piercing the heart. The operation is not over yet. Removing foreign objects only means that the most dangerous step is completed, but it is far from time to celebrate. Director Huang returned to the stage again and looked at the screen again, but the next moment, his pupils suddenly dilated. This can actually be like this? Director Huang was shocked by the picture on the screen. Chapter 38 Director, I am not worthy of being Xu Qiu's mentor. You are listening at novelfull.audio. I saw, the holes left by taking out the bamboo sticks have been completely sealed, the amount of bleeding is pitiful. Xu Qiu, on the other hand, manipulated the superconducting bronchoscope to quickly clean up the remaining airway secretions around him. At the same time, drugs are injected for anti-infection treatment. The speed is so fast that it is dazzling. Looking at Xu Qiu's skillful movements, almost perfect craftsmanship, Director Huang swallowed his saliva and said blankly, Xu Qiu, have you considered coming to the interventional department? I will apply for a special project for you and leave cardiothoracic superconducting intervention to you. At this time, Xu Qiu also completed the operation. While withdrawing the instrument, he said, this is just my part-time job. I still prefer to stay in the emergency department. Is this just amateur? Director Huang was speechless, but then, his words got stuck in his throat again. He remembered that the other party seemed to have already undergone bone reconstruction, skin flap transplantation and other top surgeries. Xu Qiu said just amateur / might be serious. The operation is over. As the first assistant, Director Huang silently filled out the surgery record sheet and handed it to Xu Qiu. Xu Qiu signed his name and added Wang Ping at the back, as a resident. Doctor, he is not yet qualified to perform this kind of surgery, and Wang Ping is his guarantor. It's a special case. Surgery waiting area. 3 young men with flowery arms held unlit cigarettes in their mouths and waited with their legs crossed. Seeing Xu Qiu coming out, the 3 of them just glanced at him and ignored him. Xu Qiu was so happy, he left quickly, and at the same time, the system's settlement voice sounded in his mind. Ding! Congratulations on completing the superconducting video bronchoscopy interventional foreign body removal surgery. Surgery rating, S level. Congratulations on gaining experience, 45. Get additional rewards, plus 3% proficiency in superconducting interventional retrieval. Rewards until next draw, 95 out of 100, comfortable. If you perform another random operation, you can win a prize, and as his proficiency increased, Xu Qiu gained a little more understanding of the superconducting interventional retrieval technique. If he were allowed to perform the operation again, the operation time can be shortened by a few minutes to less than 40 minutes. After Xu Qiu left, immediately afterwards, Director Huang also came out of the operating channel. The flower-armed young man quickly gathered around. Doctor, how are you? My brother didn't die, right? Director Huang originally wanted to catch up with Xu Qiu, but now that he was blocked, he could only look anxiously in the direction in which the latter was leaving. Well, Director Huang sighed regretfully, then looked at the 3 of them and said, the operation was successful. After a day or 2 in the ICU, there will be no problems before I can be transferred to the general ward. Upon hearing this, the 3 of them relaxed and smiled, extremely grateful to Director Huang. One of them said happily, fortunately, you are here. If the young doctor just now. I don't know what will happen. Yeah, I probably burped directly on the operating table. Director Huang saw this scene and said silently, few people in the province can do this surgery. I am not the surgeon, but the doctor who left just now. After saying this, he hurried back to the classroom. Only the 3 young men with flowery arms were left stunned. A few minutes later, in the surgery channel, Wang Ping signed the surgery record sheet and walked out. He glanced at the time. 1 hour and 5 minutes. Good. In today's surgery, the patient's abdominal adhesions were very serious. Even so, it was still limited to about an hour. My proficiency in surgery has improved again. After coming out, he gave up resting and asked the nurse, where is Xu Qiu? What operating room is he in? Director, wait a minute, let me look for it. Hey, he didn't have surgery. Wang Ping wondered, it's strange. He went to the operating room at the cardiac surgery department. He clasped his hands behind his back and prepared to rush to the cardiac surgery room, but at this time, the nurse stopped him. Director, I found it. Wang Ping, what's the operating room number? He finished the operation and left 10 minutes ago. Wang Ping's expression changed drastically. 50 minutes, besides an accident, what other reason could there be for such a short operation time? Was it because he was bleeding heavily halfway through that he terminated the operation early? A look of astonishment gradually appeared on the nurse's face, and she said, Director, the patient's operation did not fail. He has been sent to the ICU for intensive care. Do you want to take a look at the operation process? Wang Ping turned from surprise to joy and hurried over to read it. After a moment, his mouth opened wide, his expression nothing but shock. Bracket blocking, sectional interception, such bold ideas, extremely cunning control of strength, and so on. You said this was done by a resident? Even if he is an expert in extracardiac intervention, he may not be able to win regardless of time limit. Wang Ping put down the surgery record sheet, and the smile on his face became stronger and stronger. At the same time, I was a little worried. Why do I feel that if I continue like this, I won't be worthy of being his mentor? Soon after, the video of bamboo stick youth surgery was copied, and the interventional department and cardiac surgery department had 2 copies, and a day of early childhood education was dedicated to study it. It attracted a lot of admiration. In the afternoon, the quality of this operation shocked the whole hospital. Almost all departments found the surgery management department and retrieved a video. The next day, Xu Qiu's amazing interventional skills had shocked the whole hospital, many directors began to protest to the dean, demanding that Xu Qiu is the wealth of the whole hospital and must be shared by all departments. Of course, this outrageous suggestion was rejected by Wang Ping, the head of the emergency department, but in the evening, the dean sent a notice. Decision on the selection of elite doctor teams under the age of 30 in the province to prepare for the national Daxia Famous Knife Competition. The Daxia Famous Knife Competition is the highest level competition in the domestic medical community, for doctors under the age of 30, it is held every 3 years, the winners will receive generous rewards, and their hospitals can get medical equipment worth tens of millions for free. The trouble is that the competition time overlaps with the postgraduate entrance examination. Wang Ping had a headache. If Xu Qiu is allowed to participate, Linhai First Hospital, which has not achieved any results in previous years, should at least be able to advance to the provincial selection. But, for now, I am afraid that I can only wait until 3 years later, when Xu Qiu is 27 years old, to participate again. Send it to Xu Qiu first, so that Xu Qiu can prepare well. At this time, the emergency department, clinic number 7. Next. In Chen Xiao's crisp voice, an old lady walked into the clinic. Xu Qiu glanced at the patient information, then looked at the old man who was staggering at the door, and his heart jumped. Chapter 39 Master-level experience in locating chemotherapy foci. The oncology department was shocked. You are listening at novelfull.audio. The age and appearance are so inconsistent. The registration information showed that the old man was only 59 years old, however, the other person's appearance looked like he was at least 80 years old. After Chen Xiao helped the old man sit down, Xu Qiu began a routine consultation. A minute later, Xu Qiu typed a few words on the computer. Seborrheic keratosis. The old lady stretched her neck and said, "Young man, do you have a partner? My granddaughter will go to college this year. She has 2 apartments in the local area and she is also very beautiful." Chen Xiao stood nearby, having a hard time holding back his laughter. Xu Qiu silently prescribed some medicine and said, "Mom, go get the medicine. You are in good health." The old lady came over and looked at it several times and asked, "What is fat and keratosis?" "Young man, can you tell me something I can understand?" Xu Qiu, age spots. Hearing this, the old man was stunned on the spot. She burst into tears and said, "Young man, why don't you know how to take care of my psychological feelings?" Chen Xiao quickly led people out of the consulting room. She comforted him outside for a while, then came back holding back her laughter. Xu Qiu said, "Have you been comforted so quickly?" Chen Xiao opened his palm, and inside there was a note with a number written on it. Chen Xiao said, "Teacher, this is the phone number of the patient's granddaughter. She said she must ask you to add her granddaughter." Xu Qiu has long been accustomed to this kind of treatment. He asked Chen Xiao to keep it by himself, and then started consulting the next patient. At noon, Xu Qiu clocked out and finally saw Wang Ping's message. Provincial selection. It happens to be the days when I'm taking the postgraduate entrance examination. Xu Qiu thought about it for a while. If you finish answering the questions within an hour, then you can rush over and it will be completely in time. At that moment, he decided to sign up, because, if you win the famous sword competition, you will be eligible to apply for a RD fund worth 100 renminbi million, and there are opportunities to call national laboratories. And this is a condition that Linhai No. 1 hospital may not be able to provide. In the past few months, we will first form the team. The competition is based on surgical teams. Xu Qiu is not worried about this. With him as the surgeon, it's enough to have a few doctors under 30 years old, with sound limbs, who can eat when hungry and drink when thirsty. The daily life in the emergency department is still busy and trivial. After completing an operation in the afternoon, Xu Qiu finally ushered in a new round of lottery draws. Ding! Congratulations on winning through the lottery, master-level experience in localizing radiotherapy lesions. This time, it wasn't surgery, it is the ability that all oncologists dream of. Lesion location. The difference between oncology and radiotherapy and chemotherapy doctors is actually reflected in the location of lesions and the selection of chemotherapy areas. Bad oncologist, his treatment plan was to bombard the ants with cannons. The ant is dead, however,
a lot of the patient's normal cells and tissues also die, which comes at a high cost, but top oncologists are more like bullets hitting balloons. Use the minimum chemotherapy dose and target area coverage to achieve the optimal treatment effect. Now, after receiving the award, Xu Qiu seemed to have been immersed in the field of chemotherapy for more than 40 years and knew the positioning of chemotherapy for various diseases. The treatment of radiotherapy and chemotherapy for various tumors has been engraved in his mind. Director, in the oncology department, can you send me some of the radiotherapy and chemotherapy plans that have not yet been implemented? Xu Qiu couldn't wait and sent a message to Wang Ping. Soon after, the oncology department sent several chemotherapy plans. Unfortunately, there is no accompanying medical record. The oncology department just thought Xu Qiu was curious and didn't realize what he was going to do, so they didn't bother to print out the medical records. However, this did not stump Xu Qiu. Combining the images on the plan, Xu Qiu took out a red pen and quickly sketched on it. This place can be reduced by another third. The radiation dose here should be adjusted smaller. It's been omitted here, and here's another pointless radiotherapy area. 10 minutes later, Xu Qiu called Chen Xiao and asked her to send back the radiotherapy plan. On the road, Chen Xiao couldn't hold back her curiosity and glanced at the first page. Seeing the dense red marks on it, she looked a little more surprised. Will the teacher also do the positioning of radiotherapy targets? It turns out that the oncology department is also counting on teachers for help. Chen Xiao's face turned red and she clenched her fists, feeling extremely happy. We can't delay the patient's treatment, we have to send him as soon as possible. She quickened her pace. A few minutes later, we arrived at the oncology department. Chen Xiao quickly handed over the plan to a doctor in the office. The other party took a look and said, "Isn't this the plan your emergency department wants? Why send it back? There are a lot of ghost drawings." A hint of anger appeared on Chen Xiao's face. How dare you say that the teacher's things are ghost drawing charms? She glanced at the other person's badge, Wan Huiwen, attending physician in the oncology department. How dare a young attending to be disrespectful to the teacher? She held the plan in her arms and did not hand it to Wan Huiwen. The other party didn't take it seriously and smiled contemptuously. "Little girl, I sent this plan. Now that you are sending it back," it was Xu Qiu who revised it. Chen Xiao remained silent. Wan Huiwen continued, "Why do you emergency department members interfere with our oncology department? Xu Qiu still needs to ask me for advice. Bring it here, I'll help him see how the target area is delineated." Chen Xiao shook her head. "Thank you, Dr. Wan, I won't bother you anymore." Wan Huiwen snorted and turned around to continue dealing with the case. After a while, the deputy director of the oncology department came. Seeing this, Chen Xiao quickly handed over the plan. Deputy Director Qiu was a little surprised. It turned out to be the plan modified by Dr. Su. Then I'll see for myself whether Dr. Su has the talent to be our radiotherapy and chemotherapy doctor. Everyone in the office came to the party and gathered around. Are these the 3 patients who will be treated with radiotherapy today? Hurry up, come and see what level the genius in the emergency department is at. Everyone gathered around with the intention of watching the fun. At this moment, Deputy Director Qiu in the center spread out the plan and glanced at it casually. After more than 10 seconds, his casual expression suddenly became serious. Deputy Director Qiu returned to the first page and carefully read and considered every place that had been modified with a red pen. Soon, the whole office fell into silence. Wan Huiwen also held a plan in his hand, and the contempt on his face had disappeared, replaced by embarrassment and shock. 10 minutes later, Deputy Director Qiu said in a deep voice, "Hurry up, contact the radiotherapy department and immediately postpone the chemotherapy of 3 patients today. Follow Dr. Su's instructions and reformulate the plan." A doctor came back to his senses from the shock, nodded, and hurried to report the news. In the office, Deputy Director Qiu put down the 3 plans, with a look of surprise on his face that could not be dissipated for a long time. This was actually a modification completed in more than 10 minutes. In the crowd, Wan Huiwen felt ashamed and silently shrank into the corner. "Little girl, can you help me pass a message to Dr. Su?" Deputy Director Qiu looked at Chen Xiao and asked. Chapter 40. There is no worst in the emergency department, only worse. You are listening at novelfull.audio. Chen Xiao responded politely. Director Qiu, you say. Please ask Dr. Xu Qiu if he can give a lecture to our oncology doctors if he is free. Chen Xiao nodded, and returned to the emergency department with the news happily. I know, I'll go when I'm free. Xu Qiu was not surprised by this outcome. It would be strange if the master's experience in locating lesions during radiotherapy and chemotherapy could not even take down these simple tumors. Teacher, you are so amazing, I will definitely learn from you. Chen Xiao's eyes were almost starry. Xu Qiu nodded and asked casually, how is the wound recovering? Chen Xiao looked back and confirmed that there was no one around. Xu Qiu was stunned and quickly said, don't pull my clothes, I won't look. Chen Xiao smiled secretly, is the teacher shy? She answered obediently, oh, it's recovered very well. There is no trace at all now. You can't tell that you have had appendicitis surgery. That's good. Xu Qiu was speechless. Does this girl really not regard him as a man? Half an hour later, in the busy emergency department, the urgent emergency sirens suddenly sounded. Xu Qiu took Chen Xiao to the hall. A total of 3 stretchers were lifted down from the ambulance. There were a lot of blood on the 3 stretchers. At a glance, it was a mess of blood and flesh, and there were several broken fingers thrown beside. One of them screamed the most miserably, with white bones visible on his thighs, black, yellow tissue and dark red blood clots mixed together, which looked very creepy. Chen Xiao's face turned pale, but he still forced himself to look at the scenes in front of him. In contrast, many doctors, including Xu Qiu, had no expression. They looked indifferent and heartless. However, in fact, there are too many tragedies in the hospital, especially in the emergency department. Eyeballs falling out and intestines flowing out are considered minor injuries. Some people could even taste the brains flowing out of their heads. On their deathbed, they were still saying, why is it so fishy? I hate eating fish the most. Doctors, please don't give me fish. If you shed tears for every tragedy, then the person who should see the doctor the most should be the doctor himself. Dr. Su, you're here. During the transfer to the emergency room, Lu Susu saw Xu Qiu, and her nervous mood was mostly relaxed. Xu Qiu, which patient is the most seriously ill? Lu Susu, it's the one I pushed. Xu Qiu stepped forward quickly, pushed the flat bed, and rushed to the emergency room. An old lady in her 60s came with the car. She cried all the way, slapping herself in the face, cursing, and crying about the misfortune of her family. Xu Qiu listened to the general situation. It was probably that the old lady's husband and eldest son had a cerebral hemorrhage while driving a few years ago, and the father and son died on the spot in a car accident. The eldest daughter-in-law ran away. The second daughter-in-law, the wife of the patient on the bed, also took her daughter back to her parents' home, and there was no news. Accompanied by the old man's crying, the patient was quickly transferred to the emergency room. Chen Xiao reluctantly stopped the old lady at the door and said, Grandma, we will do our best to rescue her. Please wait outside the door. In the emergency room, Xu Qiu glanced at the patient's information. Shen Baokai, 43 years old. While rescuing, he asked about the patient's basic situation. The doctor on the car was relatively young. Seeing that it was Xu Qiu, he had a little more respect in his heart. He said everything. Half an hour ago, the patient suddenly fell into a coma and the vehicle lost control, which caused a car accident. The cause of the coma is unknown. There was no valuable indication during the on-site physical examination. Everything was normal. The patient's pupils on both sides were equal in size and round. They were sensitive to light reflection. However, the patient's mother said that the patient had a history of hypertension. The patient's eldest brother had a cerebrovascular accident due to hypertension and died in a car accident. Xu Qiu nodded. This condition is too clear. Most likely, it was cerebral hemorrhage or cerebral infarction caused by high blood pressure. Xu Qiu made a judgment in his mind and gave instructions. Notify the imaging department and arrange a head CT scan. You go and communicate with the family members, sign, issue a critical illness notice, and take him to the imaging department after the rescue is completed. Xu Qiu signaled the doctor on the bus. In addition, quickly open another intravenous channel. Put on an ECG monitor. Measure blood sugar.
that the rescue measures were issued in an orderly manner. Several nurses including Lu Susu immediately surrounded him and rescued him with a clear division of labor. After a while, Lu Susu reported, blood sugar 5.7. Xu Qiu nodded, blood sugar is normal, and the patient has no history of diabetes. It is definitely not a coma caused by hypoglycemia. Blood pressure, 172/96 mmHg. Lu Susu continued to report. It is a cerebrovascular accident caused by high blood pressure. A doctor said immediately, the normal blood pressure of a normal person is between 91/20/60/90, the patient's systolic blood pressure exceeded 170, which was already at the level of grade 2 hypertension, and the risk level was very high. Xu Qiu suddenly frowned. Just now, he had done a detailed physical examination on Shen Baokai. The patient did not respond, however. When pressing hard on the fingers and other joints, he had a painful expression. This was a sign of a light coma, however. Further physical examination revealed that Shen Baocai's forehead wrinkles and nasolabial folds were symmetrical on both sides, the cheeks are symmetrical. The tongue is in the middle, the limbs on both sides also respond to pain stimulation. Most cases of cerebral hemorrhage and cerebral infarction cause unilateral facial paralysis, which will definitely cause forehead wrinkles and nasolabial grooves to be crooked, and the corners of the mouth and tongue will also be tilted to one side. Blood routine, check liver and kidney function. It is not a problem to rescue the patient. The most difficult thing at the moment is to determine the real cause of the patient's coma. After doing this, Xu Qiu opened the patient's pupils again and compared them carefully. It's not drug poisoning. Among the common comas, one is sedative sleeping pill poisoning. However, this will cause the patient's pupils to change like pinpoints. However, the patient's pupils are round, which does not support the judgment of drug poisoning. Transfer to the CT room. All common causes do not match the symptoms, so we can only see if the imaging department can find something. Outside the rescue room, the old lady cooperated very well and immediately signed various informed consent forms, agreeing to all examinations, regardless of the cost, just asking the emergency department to save her son's life. After Xu Qiu completed the rescue, the old lady repeatedly told him that he had no shortage of money, so he simply scanned his head, chest, and abdomen with CT scans. He had just conducted a detailed physical examination. With his ability, he was actually a little blind. Therefore, he had a premonition that it might not be so easy to find the cause of the disease. It was necessary to do a full-body check. More than half an hour later, the results of the emergency CT scan came out. At the same time, the results of the blood routine test were also reported. Chen Xiao made a special trip and delivered the hot test report to Xu Qiu. Seeing these test results, Xu Qiu's face immediately became a little serious.